New York pain clinics can help manage your pain. Pain management, also called pain medicine or algilatry, is a branch of medicine employing an interdisciplinary approach for easing the suffering and improving the quality of life of those living with pain. The typical New York pain clinics team includes medical practitioners, clinical psychologists, physiotherapists, occupational therapists, and nurse practitioners. Pain sometimes resolves promptly once the underlying trauma or pathology has healed and is treated by one practitioner with drugs such as analgesics and occasionally anxiolytics. Effective management of long-term pain, however, frequently requires the coordinated efforts of the management team. Medicine treats injury and pathology to support and speed healing, and treats distressing symptoms such as pain to relieve suffering during treatment and healing. When a painful injury or pathology is resistant to treatment and persists, when pain persists after the injury or pathology has healed, and when medical science cannot identify the cause of pain, the task of medicine is to relieve suffering. New York Pain Clinic's treatment approaches to long-term pain include pharmacologic measures such as analgesics, tricyclic antidepressants and anticonvulsants, interventional procedures, physical therapy, physical exercise, application of ice and or heat, and psychological measures such as biofeedback and cognitive behavioral therapy. Pain management practitioners come from all fields of medicine. Most often, pain fellowship-trained physicians are anesthesiologists, neurologists, physiatrists, or psychiatrists. Palliative care doctors are also specialists in pain management. Some practitioners have not been fellowship-trained and have opted for certification by the American Board of Pain Medicine, which is not recognized by the American Board of Medical Specialties and does not indicate fellowship training. However, the American Board of Anesthesiology and the American Board of Physical Medicine and Rehabilitation have a subspecialty in pain management, which is recognized by the American Board of Medical Specialties and does indicate fellowship training. Some New York pain clinics focus more on the pharmacologic management of the patient, while others are very proficient at the interventional management of pain. Interventional procedures typically used for chronic back pain include epidural steroid injections, facet joint injections, neurolytic blocks, spinal cord stimulators, and intrathecal drug delivery system implants. Over the last several years, the number of interventional procedures done for pain has grown. As well as medical practitioners, the area of pain management may often benefit from the input of physiotherapists, chiropractors, clinical psychologists, and occupational therapists, amongst others. Together, the multidisciplinary team can help create a package of care suitable to the patient. Because of the fast growth in the field of pain medicine, many practitioners have entered the field, with many of these practitioners being not board certified or being certified by unrecognized boards. The World Health Organization, or WHO, recommends a pain ladder for managing analgesia. It was first described for use in cancer pain, but it can be used by medical professionals as a general principle when dealing with analgesia for any type of pain. In the treatment of chronic pain, whether due to malignant or benign processes, the three-step WHO analgesic ladder provides guidelines for selecting the kind and stepping up the amount of analgesia. The exact medications recommended will vary with the country and the individual New York pain clinics, but the following gives an example of the WHO approach to treating chronic pain with medications. If at any point treatment fails to provide adequate pain relief, then the doctor and patient move on to the next step.